Looks like
Going live.
Are we going live?
We are going live. Yes.
That's the smoothest
We are
start.
live.
That's the smoothest start we've ever had.
Isn't it though? That was so great.
But it's not because Mark is so smart.
Hey, and now it popped
Look,
up.
Mr. Ed's here with us too. This is so great.
There we go.
So yeah, we're here.
Now it's coming up. All right.
Yeah.
We had a false start.
We've
Sorry.
been having chats with people who weren't watching or listening, but were on the chat.
We
Deborah,
had-
thank you.
Premature
We had a whole conversation with her
video.
before we actually made the thing turn on. So we are so glad that you've joined us. We're so glad that we're joining you here 5 minutes late. We apologize for that.
Yep.
And we should be seeing, of course, the numbers are just going up
hopefully
with
it's
concurrent viewers. So
going on now.
you are finding us. We are finding you. And I'm so glad we didn't show the picture already.
Oh, yes. But, oh, no.
It's coming. Just wait. So, Mr. Ed.
Are we, I'm still questionable
Not
whether
me.
we're actually going.
Me?
Yes, we are. We are actually
Okay.
going.
All right, good.
So, thank you for joining us. We will be talking about your September medical questions,
Which means we need interaction.
maybe even some non-medical questions. Those of you who participate in the Super Chat, we thank you for contributing to the delinquency of a doctor and to Mr. Ed. Although Mr. Ed's got
I got a question
he's
for
got
you.
fruit smoothie. He's
How long is it going to take me to get cancer from the secondhand smoke we've been breathing the last 2 weeks?
We talked about that conversion the other day, didn't we?
we did, but
Last week.
I've totally forgotten what it was. So how
It
many?
was something really. So with the levels we were at, now if you're up at like 300, then it is like smoking a lot, like the
It's like
air
smoking.
quality.
with or
but-
without a filter?
I don't know, never done either. But are you wearing a mask? But when it was around like 100 to 150, if you're out in that all day, it's really only like smoking 3 cigarettes a day.
Oh, gosh, I'm relieved.
Isn't that great?
So when did you quit smoking?
Isn't that great?
But I only smoked about half a year while I was in college.
Okay.
And I don't feel any effect right now, anyway. But then I'm an old man, so maybe I'm safe.
Okay.
Got out of that. I think we only screen for what 15 years after you quit. So
Yeah. So
the
that's probably
risk
not all
must
that
go down
significant.
pretty drastically after that.
What do we have as far as the chat? I can't read it.
It's nice and small.
Will someone please
Well,
read the
Tracy
chat?
is saying, hello, Mark,
Oh, it must be Tracy Orpin.
Dwayne, and Ed. And, well, that's nice.
Hey,
of her.
Tracy. She's in the UK. She must be late for her.
Okay.
Are you supposed to be up this late, Tracy?
Who's Exquisite Candy?
Ooh.
Thank you both for your willingness to answer questions.
Wow.
Exquisite candy.
I'm intrigued by that handle.
Exquisite candy.
And I thought Dr. Vaughn was an interesting handle on YouTube and Twitter. Okay. Speaking of Twitter,
Oh no.
it wasn't.
one of the worst transitions there you could ever. Speaking of,
It wasn't Twitter. Okay, Mr. Ed, it's going to come on yours like in 6 seconds. I
wasn't. It
think.
wasn't Twitter. It was.
It was just
a text.
a text message that I sent to
To
Dr.
me.
Gwaine yesterday morning. Do you
man.
have anything you want to say about the exchange between us? It should be coming up any time now on your.
Well, I
You
got
can see my comment there.
I got another one from Exquisite Candy. I have Hashimoto's. Any natural resources?
Hashimoto's.
Hashimoto's is a new way of quieting the mufflers on motorcycles.
I take the
Hashimoto's is.
I take the Synthroid already.
Ah, yeah, the Synthroid.
Yeah, that's
So the,
synthesized thyroid.
Yeah, there's our conversation.
Should I take it? Did you see it, Mr. Ed? I don't know if you can read it.
Oh, the picture up on top.
Oh yeah,
Oh my gosh! What?
Yeah.
Should I read that?
sure. Yeah, we need your commentary.
The
Yeah.
bottom of my bagel reminds me of something from work.
I seen my bagel and I looked at it. This is what I said.
That was his text to me, as you can see at the top there. Look at my reply.
Why aren't you wearing gloves? That's great.
So let's give a little more context. I was in church when I got this
Perfect time.
text. Fortunately, I was wearing a mask, so no one saw me burst out. Maybe heard a little snicker here or there, but oh my goodness. Oh, it was.
So yeah, that's yesterday morning's text to Dr. Gwaine.
Yeah, that's what you do. To
You
me
guys would
when I'm
appreciate. our exchange. So, given that the title of this show is Your Comments and Questions, Mr. Ed, do you have anything coming through the chat?
Candy is back again.
Who?
With the
Candy.
exquisite candy.
Exquisite candy.
Synthroid medication daily.
We can talk about
Sorry, I was typing quickly.
Synthroid is a name brand medication, which is actually pertinent to the discussion of thyroid, hypothyroidism
It is.
specifically.
Yeah, it's a bit of an issue.
Okay.
Here, I'll just go ahead and do this. There you go.
Oh, you want me to talk about?
Because you're going to do a talk. You're going to do a little monologue on thyroid.
Time for my diatribe on Synthroid. And so Hashimoto's is a autoimmune disease against the thyroid that causes it essentially to peter out and no longer produce thyroid at the level that it's supposed to. So you have less thyroid in your body than you need.
Can I interrupt here?
No. So, so because of that, you need thyroid medication for the rest of your life because your body is inadequately producing the amount needed. So Synthroid is one of those, and Synthroid is a name brand of a medication called levothyroxine, which is the active thyroid hormone circulating in your body, and essentially we're just giving it to you synthetically by mouth, and it can be titrated up and down. You find the perfect dose. Now, some people are super sensitive and you need to find kind of this really precise dose. Now, they have found that for thyroid medications, the generic ones can actually be up to 10% off the actual amount that they actually say they are. So like an 88 microgram dose could be 80 or it could be 96.
The synthetic ones can be
the generic ones. Yes.
Can be off that much.
Yeah, that's what I've heard.
But
the name brand ones, I guess, have a better quality control or something, so they're a little more precise in the dose that they can. So Synthroid's a great choice, and actually is what is preferred, a brand of levothyroxine, to replace your thyroid. It is a lifelong thing. And Hashimoto, since it's an autoimmune disease, does make you at slightly increased risk for other autoimmune diseases, but that is my diatribe. Back to you. Now you can comment. No, you can't yet. So no, I'm just kidding.
Okay. So what I was going to say.
What were you going to say?
When you say autoimmune, people hear that word immune, and there are people who have been hearing that word a lot
lately. Yeah.
Because there's been a lot of talk of having people who have problems with their immune system or who are immune suppressed being eligible for, and actually it's recommended that they get an additional shot when they've had their 2 shots of the Pfizer or the Moderna vaccine. And it's actually the opposite problem.
Right.
Autoimmune is where you have too much activity of your immune system and you are not immune compromised,
right?
Unless you're taking a medicine for it, like steroids, high-dose steroids.
To decrease the immune system so you're not attacking yourself. That's what autoimmune means. Auto means yourself. So your immune system is essentially attacking yourself with auto-antibodies.
And not all of the medicines for it do that. Just the ones called disease-modifying anti-rheumatologic drugs, or DMARDs, which we know. Why do we know DMARDs? Where do we see that the most in our day-to-day being doctor business?
Lupus and rheumatoid arthritis, and
so this is where I see it. I get these little sheets from the insurance companies,
yes,
and the pharmacies.
They need to be on them, yes.
So if there's a diagnosis of one of these disorders for a patient, the insurance company or whoever is handling the pharmacy benefit will send the doctor a letter, and it says, "Hey, your patient has a condition that would benefit from taking this drug. Please prescribe it so that we have to give it to them." It's the weirdest thing. They're asking us to cost them money by prescribing these expensive drugs for the patient. Why in the world is the insurance asking us to have them have to pay for these expensive drugs? Well, I'm sure there's some conspiracy people out there thinking it's because the drug company is behind it. And that actually may be a small part of the whole big picture. But the real reason is because the patients cost the insurance company less money in medical expenses if they stay out of trouble by taking these drugs.
Right.
Candy wants to know, so am I advised to vaccinate or not?
That's the question.
Absolutely. Have we yet come across a person we don't recommend the vaccine to?
someone who had a previous, even then you should give it again. Someone who had a previous severe reaction, right? But even then, they say that you can do it. Just watch them more closely. There was a while where they said if you're on high dose steroids, then maybe you should watch it. It may not be as effective, but we still recommend it. It just may not be as effective.
And the booster?
But as a primary care doctor,
We'll get to that.
Yeah, we will. As a primary care doctor, I have not come across. Now there are some cases where I said clear this with your specialist, but really, there have not been any cases.
Yeah, and I was looking on, we'll get to that, looking on Twitter, and I have a friend who is Matthew Bodish.
Yeah.
I don't know what his Twitter handle is, but I follow him. He is an allergist. I suppose you call him allergist immunologist. And of course, his people that he interacts with are also, and I saw a conversation between him and another allergist. And the one had given zero, what would you call it? Encouragement to not take, I'm looking for a term here, zero recommendation
Exemptions?
to exemption or recommendation not to take the vaccine. Zero.
Oh, okay, gotcha.
And then Dr. Bodish said he had only done for 2 out of his entire panel of patients, and those 2 were extremely unique situations. So it's not just that they had a particular diagnosis or they'd had a particular reaction. It was something else.
beyond that.
And I need to ask him actually what maybe we should have him on the show and ask him.
We should.
Debbie's back.
Debbie is back. Yes, we want Debbie back. So what was your question, Mr. Ed?
Booster.
Booster. Oh, I'm sorry. I did super chat too late.
Woo!
Okay.
That's what Debbie did
That's the button.
before the show started.
Hey, we appreciate
Thank
it.
you, Debbie. We appreciate it. Okay, now back to Mr. Ed.
Third
Debbie's asking again,
Dose.
and I take.
Wait. Did we answer the third dose booster question, or are we going
That's
to
his
Deborah?
question.
That was my question.
okay.
Should we be taking the booster? I mean, yeah, keep going. I mean, absolutely.
So we've talked about this a little bit,
Yeah.
but we'll address it again because it's updated in the last week.
Yeah.
Right.
Okay.
So we were saying that there was the studies from Israel that showed that, hey, there's benefit from getting another dose of this vaccine. You're better protected than if you had only had 2 doses. And then we have a number of studies that aren't out of Israel that show that, yes, there is a difference. People who get a booster 6 or 8 months out are a little better protected than
Yep.
people who don't, but it's very little. And more studies are getting attention in the U.S. press and in the medical literature all the time here, and it's less and less and less recommendation that we look at general booster, at least at this time. That could change, as we go on. But there may be special groups, and Dr. Gwain and I were talking about this
Just this morning.
that maybe people over the age of 65, which many of our viewers
Yeah.
are, and even
gosh.
somebody here at this
That's me.
broadcast is over 65.
Hey, question from Debbie. Debbie's back. Ronker.
Hey, all right.
And it goes back
She
to
got a super
Synthroid. I take Synthroid 200 milligrams because I had cancer of thyroid.
Yeah, you probably either had it
yes.
ablated or radioactively killed or removed.
And something interesting about people who have had cancer of the
Probably
thyroid,
removed for cancer.
normally when we're adjusting the dose of thyroid medicine, it's based on I guess would you call it a prohormone or there's a word for those hormones for hormones. So the hormone that stimulates the thyroid
The TSH.
to make hormone called TSH, we usually adjust the level of thyroid medicine according to that and try to keep it in the normal range. But people who have had thyroid cancer, you don't want to do that. You want them to have 0 TSH or nearly 0 TSH because you don't want any of that thing stimulating activity of thyroid or growth of thyroid cells or anything at all having to do with thyroid when it had cancer and was removed for that reason.
And she says, because of my thyroid cancer, my endocrine system is gone.
The thyroid part of your endocrine system would be messed up for sure.
Yeah, you still have
But
an endocrine system.
everything
Yeah,
else,
yeah.
you should
You
not
still
be.
have a pancreas and you still have
Adrenal
glands.
and
Yeah.
Well, here's a new name. Juanita Minch.
Oh, okay.
Ah.
I have had 2 vaccine shots. Can I take the booster shot? I have chronic kidney disease stage 3.
So at stage 3,
There we go.
Yeah, that's a great
good question.
It's probably not to the point where you would be considered immunocompromised.
No.
And right now, it's only recommended. The third booster shot is only recommended for those who are in an immunocompromised state. Stage 3 would not qualify for you that. Would qualify you for that.
I'd actually have to look it up, but I would be willing to say it's either stage 4 or even further along.
Right. Yeah. 5 or on dialysis,
Yeah.
definitely. 4 questionable.
Yeah.
But yeah, 3 probably not. Not probably not. No, it's a no.
It's a no.
Yeah.
Gwen, this sounds like one of your girlfriends. La Shunda Williams.
What? That sounds like.
The question is, do you recommend taking vitamin D3 daily or weekly?
Oh, yeah. Now, sometimes
You can do it either
there's
way.
reasons to do it weekly.
Yeah.
The endocrinologist will sometimes prescribe tens of thousands, like 50,000
Yeah.
units in a single dose on a weekly
Once a week.
basis, and usually it's for a limited period of time. Usually it's
Right,
not
yeah, that's usually
to
not
get you
long-term.
building up your stores, and then you go down to a daily dose that's in the thousands of units
Yeah.
daily.
I typically recommend people take 2 to 5,000 units a day, and if you're doing that, you're not going to overdo it. You're not going to get your vitamin D up over a level it should be. So if you keep it 5,000 daily or lower, you're probably going to be good. Most people need to get it though, because we don't want you going out and getting it in the sunlight, because then you get cancer, skin cancer. Yeah. Okay. It's a trade-off.
All right, I think we're caught up with your comments and questions. Yeah. Of course, we've learned that our delay on the show, the lag, is about 6 seconds, or maybe a little
Oh,
longer.
sweet. So we can cuss on this. Oh, wait, that's not what that means?
That's delay. That's a cutoff delay.
Is that at all what I was getting at?
Oh, okay. I didn't know where you were going with that. I thought we had a 6-second delay there where I could.
Wasn't our texting bad enough? Okay. So, yeah, it does look like giving it a little bit of time there. Oh, here we go. She thanked us for the comment.
Yep.
And we do thank our viewers. We thank the people who participate in Patreon, both for Dr. Green Knight and for Dr. Vaughn.
Yes.
And thank you. And those people who do the super chat, we thank you because we abuse our bodies with Dutch Brothers. And we don't, do as I say, not as I do. We're not encouraging you to do this. But I sure do look forward to it all week long. I'm looking forward to my time with you, whoever you are who pays for my Dutch Brothers.
Is that what it is?
Mr. Ed, did you have any final words for our listeners and viewers?
Well, Exquisite Candy says, you guys crack me up.
Yeah.
Oh, kind of like a bagel.
Gee. Oh my goodness. Okay, we better end soon.
It's degrading.
Dr. Gwain, anything
going
you wanted?
down.
You had your post today.
I did.
Did you want to touch on
Yeah.
that before we?
Sure. Yeah. So over at drgreenknight.com, weekly blog post is up. You may have heard that last week the Biden administration talked about some mandates for the vaccine. I have some feelings on that, and I wrote a blog about it and how I do not feel this is going to be helpful. And actually, I think it'll hurt us in the long run. So you can go over to drgreenknight.com, check that out. And,
Yeah.
Yep.
And I read it, and we are not the same person. But we are the same as far as our recommendation for the mandates for people in healthcare.
Yep.
And I would throw out for first responders, and
I would call them in healthcare.
I would say people in the military.
They don't get a choice.
I was going to say your body is not your own when you're in the military anyway.
You
so
signed on the dotted line for that
it
one.
really doesn't seem to be significant for requiring the military. And then the other group we would talk about is people in education, teachers. I think I'd probably be a little bit more for it than Dr. Gawain would.
I understand it, but
You understand it, yeah. So it's
Yeah.
something we can have a
I
conversation
have my
about.
reservations.
But as far as
The general lay public,
yeah,
Yeah.
if you're going to do that, it's clearly just a public health measure in that circumstance. And I understand why you don't like it, and I have not the most comfort with it. We'll just say that. So it's a conversation we have.
so yeah, if you want to, leave your comment over at drgreenknight.com.
Yeah, do.
Let us know what you think.
And I want to, does anybody want to thank?
Absolutely. Teresia Rowatt over at
Absolutely.
Patreon. Dr. Green Knight is the handle there. Thank
Yes.
you for what you do.
And thank you for all your comments on this channel. And also Lindsay Antwine, thank you. And thank you for participating in this show when it was initially put out last Friday by accident when I was just off in the corner here working on a computer and you guys were trying to chat to me.
I saw
an
that,
accident.
and it was a good thing I texted you. Say,
it's kind of opposite of what
you're
we did."
live. You know that, right? Somebody was asking specify the blog post. So it's Dr. Green Knight, DrGreen So
I will put a
Green
link
Knight, like the movie that came out after
years after.
years after I got that. So
Okay.
Dr. Green Knight. So,
Till
check
next
it out.
time.
Hey, I'm Dr. Wayne Vaughn.
And Dr. Mark Vaughn telling you,
And he's
Mr. Ed.
Mr. Ed.
Also Mr. Ed over there. And we're telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.